The mission of the Richard G. Lugar Center for Rural Health is to advance rural health through education, innovation, and collaboration.
The Lugar Center for Rural Health was founded 20 years ago by very gifted physicians and those in healthcare who noted the scarcity of physicians and other healthcare people in the counties in western Indiana and eastern Illinois. Mercifully, they have succeeded in attracting remarkable students and brought them together with equally remarkable physicians to provide a new security, a new safety, a new quality of life for the areas they serve.
The Lugar Center developed one of the first rural training tracks in the Midwest based on a hub-and-spoke model. To date, this program has graduated over 100 physicians, the majority of which care for rural and underserved populations in the U.S. and abroad.
One of the hallmarks of the Lugar Center for Rural Health has been the development of the rural medicine program at Indiana University. Having been in rural practice in my hometown of 2 stoplights for the last 27 years, I clearly understand the challenges, but also the rewards of rural medicine. Our program so far has 75 students now in the rural medicine program. The first class has actually gone out into practice now and are serving rural Indiana. We've also learned that you need an interdisciplinary approach to be successful in rural practice, and we're also training nurse practitioners, physician assistants, and social workers in our program.
The center has designed and implemented numerous outcome-based projects aimed at advancing access to and quality of health care in rural areas. Examples include a patented store and forward telemedicine platform, rural house calls, an online patient portal, and the Wabash Valley Rural Telehealth Network, which brings together independent rural providers and facilitates an average of 6,000 live consults annually. The Lugar Center was also integral in the creation of the Rural Health Innovation Collaborative Simulation Center, which created a learning environment which students across disciplines work together to care for patients using real-life scenarios and lifelike electronic patients that mimic actual human conditions. The Lugar Center serves as a catalyst for dialogue, collaboration, and action aimed at advancing rural health. Development of strategic relationships through partnerships with stakeholders aligns resources, builds stronger communities, and leads to opportunities and solutions to address barriers to access and availability. This is best illustrated by the role the center has played in the development of legislation aimed at addressing barriers to rural practice and the creation of the Clay City Center for Family Medicine, a rural health clinic, Valley Professionals Community Health Center, a federally qualified health center, the Indiana Rural Health Association, and establishment of the first AHEC Regional Center in Indiana.